Welcome to ESC Television. I am Steen Christensen and I'm at ESC Congress in Barcelona. And I have the pleasure to have with me 3 young cardiologists from the Cardiologists of Tomorrow. And we have Maria Rubini, we have Afzal Sohaib, and we have Alan Boom. And I really look forward to discuss some of the highlights of the Congress with you. So the theme of this Congress was 40 years of PCI. Is that interesting for young people?
Definitely. I think for us young people it was really important to see the amazing achievements that the PCI has done over the last 40 years. I don't know what you think, guys. But...
Oh, it was really great, the sessions. For example, Maria, did you know that the stents were originally used to treat the complications after balloon angioplasties? I didn't know this.
I didn't know that.
Well, I can tell you, I certainly know, because when I started training, we didn't have stents, and then stents was introduced, and you have to sit with the stent and you have to crimp the stent on the balloon. You had a little sort of magnifier where you could put this on, and then you introduced it into the patient. And if you couldn't get it into the coronary arteries, the stent might fall off. And this is what happened quite often. And of course, nowadays, it's a lot easier. I think also at a congress like this, one of the important things, of course, are the late-breaking trials, the real new things. So did you enjoy any of it? What did you pick up, Maria?
Well, I'm interested in acute cardiac care, so for me it was very interesting, the DETOX-2 study, showing that among patients without hypoxemia, presented with suspected QMI, we don't benefit from using oxygen therapy. So I think that will change our clinical practice in our future as young cardiologists.
I agree also in my place. And what about you? Did you pick up something interesting from the Hotlines?
Oh, absolutely. So I'm an electrophysiology fellow, and the CASTLE-AF study was probably the one which struck me the most. So in that study, they looked at AF ablation in patients with symptomatic AF who have heart failure, and the trial investigators found that actually mortality was reduced following AF ablation. Yeah. I've never seen that before with these trials before, and I think that'll really inform the discussion I have with my heart failure colleagues, and also when I'm counselling patients about AF ablation, just to tell them that we really do have this strong data to show them that they would benefit from this procedure. Yeah,
absolutely. I think actually we have to think more about the heart failure patients, whether they will really benefit from an ablation. I thought that was amazing also. And you, Alan, did you pick anything up during the Hotlines?
Well, of course, for me, the best of the best was the COMPASS trial, and it's my 5th ESC Congress, but I don't remember that the main auditorium was so crowded as it was during the first Hotline session, where also the COMPASS trial was presented. And maybe it sounds controversial to add an anticoagulant agent on the top of the aspirin in the patients with coronary artery disease. But we saw that really it doesn't reduce only the major adverse cardiovascular events, but even the all-cause mortality. So I think huge thing. And really a game changer in the clinical practice. Maybe we have to wait a bit, but I think this will be.
Yeah, I think also this is very interesting, and of course now we need to digest it and see if we should treat all patients with stable vascular disease or whether we should pick some. So I think that's very important. So I think also another feature of this Congress is the guidelines. I mean, we always release new guidelines during the ESC Congress, and this year we had 3 guidelines and 1 consensus document. Maria, did you pick up anything particularly of interest from these guidelines?
Well, I will pick up the take-home message, the STEMI guidelines, especially the radial approach preferred to femoral approach as the approach of the future. What do you think?
Yeah, I'm also trying to learn the radial approach, so I'm working hard on it. And what about you, Alan? Did you pick up something particular?
Yeah, of course. I'm really interested in the field of antithrombotic therapy, so very important for me was the consensus document for dual antiplatelet therapy. And especially I'm really happy that the scoring systems regarding the duration of the dual antiplatelet therapy after PCI made it to the guidelines. I was already using the DAP score. It is also the precise DAP score available. And I really like that this is a step forward toward personalized medicine, because we know that every patient is special and we have to tailor definitely the duration of dual antiplatelet therapy for these patients after PCI.
What about you, Afzal? Do you have any comments on guideline from the guidelines? Anything in particular you picked up?
Yeah, so there were also the new guidelines on peripheral artery disease and valvular heart disease, and with the valvular one, there were a number of changes from the previous guideline. But I think for me, it's probably the app which accompanies the guideline, which I'll find most useful when I'm seeing patients on the ward and in clinic, to see which cutoffs and which indications and which approaches are right for patients. So I think that's a very useful feature to kind of keep me up to date, because it'll be difficult to hold all of that information in my head all the time.
Yeah, I think I'll also have to try to learn how to use these apps. There was a lot on digital health also here, and it's, I would guess, is a theme that is very interesting for you, and of course it's the future. Anything you picked up there?
Yes, I think for us as young cardiologists, what's a great achievement, the social media, that the ESC is now so active in social media, because at the end, we young people, we communicate via social media, we learn via social media, so I think it's great that the ESC, it's so involved now in social media.
And I must say that the cardiologists of tomorrow have really pushed us there and helped us a lot to try to implement this. And this is very good, I think, for communication and discussion.
Absolutely.
It's also great that finally we have an official Cardiologist of Tomorrow ambassador for the Twitter, who will update all the Twitter audience with the new things in the science, in the cardiovascular medicine. So that will be really great.
Thank you very much. So would you want to have a final comment?
Yeah, no, I'm near the same. It was a very prominent feature of the conference, just from the opening speech, when we had Eric Topol talk about digital health and machine learning, and we're cardiologists of tomorrow. I think the way we practice in the future may be completely different, and digital health may completely transform the way we practice and the way that PCIs transformed things over the last 40 years.
Yeah, that was fascinating. I agree. To help. But I really would like to thank you. I hope you have enjoyed the Congress. I certainly enjoyed being here with you. Thank you very much.
Thank you.